Assalamu alaikum. I hope that you guys are doing well. So now today the topic that I am going to discuss with you people is headache. So we have different types of headache, but I'm concerned about tension type, migraine, and cluster. So now how you are going to tell that which type of headache a person is having? So basically when it is going to be bilateral it would be a tension type, but if it is unilateral then you would be like either it would be migraine or cluster. So if at first you are going to ask the person that if he's or she's having a headache which is bilaterally or unilaterally, then the duration. So if the duration is more than 30 minutes, which can be typically 4 to 6 hours, and it just stays there, it's constant, it's not going, so it would be tension type. Then if it is unilateral and if it is more than 4 to, it's between 4 to 72 hours, almost like 3 up till 3 days, then it's migraine. And if about 15 minutes or 3 hour and is unilateral and it is repetitive, which means it is occurring after a few some time or a few minutes, then it would be cluster. Now the tension type patient actually presents, and he or she is going to say that the it is a steady or band like pain, like this. It is steady or band like pain, no nausea or vomiting, no more than one of photophobia or phonophobia, no aura, most common primary headache and more common in females. So it is the most commonest one, and females tend to have this type of headache more. Okay, then we have a treatment of it. We are going to treat it by either by acute or and prophylactically by some drugs. So if acute management, then it would be analgesics, some painkillers, NSAIDs, then acetaminophen. So painkillers are going to be the first choice. Then prophylactically, so that they don't occur, so we are going to prescribe them TCAs, like amitriptyline, or and we are also going to give them some behavioral therapies for that. Then migraine is basically a pulsating pain which occurs with nausea. This one does not occurs with nausea, and it's a band like one. This one is pulsating and it is associated with nausea, photophobia or phonophobia, and it may also have aura. So it's just the opposite of this tension type, but it is a pulsating pain. Then due to irritation of cranial nerve 5, which is trigeminal nerve, which has 3 branches. So, or if the meninges get irritated or any blood vessels, they get irritated because they release, when they get irritated, they release some vasoactive neuropeptides, for example, substance P, calcitonin gene related peptide, and this one is also more common in female. Okay, so there's a mnemonic over here, that pound, which means pulsatile, it's 1 day, it's unilateral, then it is nausea, and there is disability, because it is so painful that person cannot work easily, or any daily activities can also be not performed really well because of this sort of pain. It's a pulsating pain, really sharp pain. Okay, then we have a treatment by any acute medication or a prophylactic. So the acute one includes NSAIDs, triptans, dihydroergotamine, antiemetics, because vomiting or nausea can also be there. So antiemetics are going to be given. That would be prochlorperazine, metoclopramide. Acute would be NSAIDs or triptans. Do remember this one. Then prophylactically, some lifestyle changes, sleep, exercise, diet. Then beta blockers would be given. Amitriptyline is a calcium channel blockers. So so amitriptyline basically dilates the blood vessels. So they also might help relieving the pain. Then botulinum toxin, anti-CGRP monoclonal antibodies as well. Then we have cluster headache, which is 15 minutes to 3 hour, and it is repetitive. So basically this one is a suicidal headache, which is like excruciating periorbital pain with autonomic symptoms. For example, the person is going to be crying, like, I mean, there will be lacrimation, then rhinorrhea, something coming out of the nose, mucus coming out of the nose, then lacrimation means some the water coming out of the eyes, conjunctival injection, which means redness of the conjunctiva. Then we have, they may present with Horner syndrome, which has um, some specific features like meiosis, meiotic eyes. There are like typical three symptoms of Horner syndrome, and this cluster headache is more common in females. The only headache, it can be migraine, can occur in males, tension type, but if asked more common or most often, then that would be cluster headache in males. Then you are going to similar treatment is, it is going to be somatriptan, like triptan and migraine. You can give triptan, somatriptan over here with 100% oxygen, and prophylactically you are going to give verapamil. Over here you were giving amitriptyline, over here you are giving verapamil. Do remember this. So this was it. I hope so you guys have understood this, and if you have, then do recommend my channel.